to Radio CAHS, presented by CAHS Chief Executive Dr. Aresh Anwar.
Welcome to Radio CAHS.
I'm sorry we're a bit late, but welcome to the 14th edition of Radio CAHS. Today is a COVID special, as I've got it in inverted commas because I think the term is celebrate the 1-year anniversary of discovery of a new virus out of China, but I think it's with very heavy heart and black clouds that I think we make that announcement. We're very lucky. We've got Dr. Briony Hazelton, who's an infectious disease consultant PCH, with us today, Richard Prunster, the Director of Workforce, and Professor Chris Blyth joining us as well. That's because I think everyone recognises that you actually need experts to answer your questions. So I was disempowered, and the experts join us today so that the answers you get are timely. And you can leave, I hope, satisfied having had those answered. Before we get going, I just want to acknowledge the traditional custodians of the land, the Whadjuk people of the proud Noongar nation, and pay my respects to elders past, present, and emerging. I also want to reflect on some changes that are going to be occurring at PCH. The first is really to thank and celebrate Fun on 4 at PCH. This week we announced that after 4 years, the Foundation has decided that the continuing operation of Fun on 4 may need a different prism, and we are going to change the way we operate Fun on 4 so that the current way in which we're working will cease on the 11th of December, will close for 2 months for transition, and then our new partners will take over the running of Fun on 4. And I'd really like to both thank the Foundation for the enormous support they've provided over the past couple of years, but also at the same breath express my excitement that that spirit will be continued in the safe hands of Ronald McDonald House Charity. So thank you for them for embracing this amazing opportunity to work with children and families in Western Australia. Starlight and Radio Lollipop are going to remain open during this closure, as well as some alternative entertainment options while we transition. Thank you again to PCHF, and welcome to Ronald McDonald House Charities in this new role. We also celebrated the World Prematurity Day this week, and I want to pass my enormous thanks to the dedicated staff who look after our tiny babies, both at PCH and King Edward Memorial NICUs. Huge thanks to you. It seems as if we're doing a lot of jumping because I'm going to go from NICU to the bake-off. So the palliative care bake-off is once again on this year. There will be some adjustments, but I have no doubt that the sense of competition that normally embraces this will be once again grasped with both hands, and we'll see whether our long-standing question as to whether a vegetarian sausage roll can be classified as a sausage roll can continue to drive live debate. We have been using Radio CAHS as a medium to communicate and enhance information exchange, but appreciate that the staff forums have previously provided a mechanism to do this and planned to run a staff forum on the 4th of December. And want to acknowledge that really life has been very, very different this year due to COVID, and we're going to touch on that. Travel, sports, events, theatre, school, work. We've had to be flexible in so many ways, and I'm really actually, I suppose, asking for just your support. We haven't yet finalised the arrangements for our Christmas breakfast and lunch this year, but please be assured that the team are working really hard behind the scene to make this happen. I've been asked to slow down, knowing that I race through my reading. We could have cancelled staff Christmas this year, but I think we really want to, in some way, reflect our thanks to you. And this provides one point in time in year where we can pause, reflect, and celebrate you as colleagues. So can I please ask that you're patient while we finalise events, and we'll let you know the details as soon as they are confirmed, but we are currently looking at Friday the 18th of December being the date on which we celebrate Christmas lunch and breakfast. Today we're going to go to talk about COVID. Can I just reiterate an ask really, and that is, when you listen to the show today, can I ask you to pause and reflect around what the messages that we are discussing mean in terms of the actions that we as individuals have to take and the behaviors that they are telling us to demonstrate. We have been in a very, very unique position in Western Australia, and whilst there's a huge amount to celebrate, there's always a concern that comfort and security brings with it complacency, there really is still no room to be complacent, and I really want us all to sit and pause every time we get a response from one of our experts today about what the implications are for us as individuals and the way that we're working. So you've probably heard me natter on long enough now, and I'm going to ask for a sting that would
Call now on 6456 5629 or 0436 595 600 to ask a question.
Briony, welcome.
Thank you very much for having me again.
No, it's super actually. We're always excited when you join us. I mean, you form part of this stellar department that's been able to really shine during COVID in terms of demonstrating to the organisation the scale of expertise we have. So welcome. I wondered whether you would mind if I just picked your brain around COVID.
Absolutely.
Let me just start a bit about South Australia and the outbreak. Can I ask you, what do the changes to border arrangements mean for visitors to both PCH and our community sites?
So I think, as most listeners would be aware, our hard borders for WA came down on Saturday. And what that meant was that we now had two categories of states. We had the very low risk states where there was no cases of community transmission in the previous 28 days. And for those groups, which at that point in time included South Australia, meant that people could enter the state without having to do the 14-day quarantine period and didn't have to have any testing, because it was deemed that there's no transmission in those states, so they're effectively in the same bubble as WA. At that point in time, New South Wales and Victoria were deemed the low-risk states, so while they've done very well in getting their numbers down, while there are still a couple of active cases, entries from those two states were still under quarantine direction, so did have to quarantine at home for the 2 weeks. And so what that meant for PCH was that we still needed to screen on the front line to see if families had recent interstate travel, but it was only for those who had been in or transited through New South Wales and Victoria that we needed to do something about that. And for PCH, that would be either directing that family back to home quarantine, or if there was a necessity for treatment here, managing those quarantine requirements here at the hospital. But unfortunately, with what happened in South Australia, that they over the weekend, with their just recent cluster of cases, means that South Australia is now in the group with New South Wales and Victoria. So when we screen for interstate travel, need to escalate if someone has been in or through South Australia as well.
Okay, so and I think it's interesting, isn't it, how things can turn so quickly on a pinpoint, really, because, as you say, we entered the weekend with South Australia at least appearing to be very much in the same boat as Western Australia.
Yes, absolutely.
And can I ask, if staff want to find out about the processes and guidelines about visitors, where would they go to?
So something we've had developed from really quite early on, March, April, were some flow charts with some guidance on the screening questions and then the actions to be taken depending on the results. They're all available on the intranet, so the COVID hub has all of those. There's also, during working hours, infection prevention and control are available to take those kind of questions, and after hours we've got cover with clinical microbiology.
That's brilliant. Thank you, Briony. I know one of the big bones of contention or has been around the entrances and then control screening points. Any thoughts around, or what are the plans around the doors, do you know, and also setting up controlled screening points?
In terms of the screening points and our screening processes, it's very much linked to the stages of the pandemic and the kind of current activity at that time. So I think and it is all in planning, what we'll find is if and when we do have cases of community transmission, we'll revert more back to the model that people would have seen back in March, April, where we have that staff entrance to try direct staff through one way and have a central entrance for our children and families coming into the hospital.
And are we screening everyone that comes onto our site, or just those coming in for appointments and to visit the wards?
We're actually seeking some clarification on that this week, but it is at this point in time, it is just those coming in for appointments or to the wards. So someone visiting just the food hall doesn't necessarily need to be screened.
And Briony, I'm so sorry, I'm going to be really pedantic about this, but this issue of screening ultimately, certainly for staff, and the message to children and families is, if you are unwell, the safest thing to do is to not come to work.
Yes.
And then consider being tested. Is that right?
Absolutely. And that's been the consistent message throughout, and it's probably one of, if not the most important thing that people can do, is that if they have symptoms consistent with COVID, which essentially are those upper respiratory tract symptoms, is not to come to work, isolate yourself at home, and if those symptoms are consistent, consider having a test at one of the COVID clinics.
Can I ask you again a stupid question? Isolation versus quarantine. Mm-hmm. Is there a difference?
Functionally, it's essentially the same, but quarantine is a state-mandated process. So somebody who is in quarantine,
yes,
as it stands with this illness, that is a 14-day period where you need to stay home, and it's the period that is deemed to be the incubation period. But that is a state-mandated process. Isolation is more to do with while you are symptomatic, to try prevent yourself from spreading whatever infection you have onto somebody else.
And then the other bit that I know certainly for healthcare professionals has been very prominent is this challenge around fit testing. Mm-hmm. Again, let me start with the first question. What does fit testing actually mean? Yeah,
there's probably a couple of terms that staff would have heard. So there's firstly fit checking, and then there's fit testing, and those two processes are distinct. So fit checking is part of our business as usual, and it's something that every individual should be doing every time they put on an N95 or P2 mask. And it's essentially just checking that you have an adequate seal, which is the entire purpose of wearing that kind of mask. So that's every time it's put on. Fit testing is an more objective way of further checking that you can get an adequate seal with the mask, the N95 or P2 mask. There's two different ways you can do it. There's qualitative and quantitative fit testing, and the program that we're looking at rolling out on a state level is the quantitative fit testing.
And quantitative fit testing is essentially, it's an objective measure. It's nothing about how you feel or your perception. No. There are numbers involved.
Yes.
And it's a sort of black and white phenomena. Is that right?
Absolutely. It's a very objective measure. You need a machine called a Porter count, which is essentially measuring microparticles in the air outside the mask and inside the mask, and it gives you that differential measurement to tell you whether you've got an adequate seal.
And can I ask, it brings that extra added layer of assurance that the mask is fitting and protecting you. When do you think we can expect to see the process starting for CAHS staff who meet the criteria? Because am I right, not everyone actually is going to need fit testing. I mean, that's a very important message, isn't it?
Yeah, no, that is correct. I mean, it is a very labour-intensive process because you do need that one-on-one interaction with the staff member. So it is something that needs to be rolled out on a graded basis. So there's been a lot of work going on behind the scenes in trying to develop a risk matrix. So essentially the program is going to focus on those who are most likely to be caring for or having to manage COVID positive patients, and then secondarily those who are going to be particularly at high risk, so those who will be present when aerosol generating procedures are performed or have direct airway contact. So people who are intubating regularly are certainly in the high risk, and the program is being developed to develop that priority list of how we're going to go through staff members to make sure that those who are most likely to need it get it first.
And I just want to reiterate a couple of points, Briony, if I'm right. One is that this process of risk stratification has been very carefully thought through. So it's not an act of omission. We have worked out who is most at risk and therefore is likely to need this additional layer of assurance.
Yes.
So it's not an act of omission that we just decided that, look, one group of staff is not seen as any more valuable than another. It's based on risk of exposure.
Absolutely.
And can I ask you, when do you think we can expect to see the process starting? Are you telling me that we have actually started that process of getting the framework in place and identifying staff already?
So at this site, preparations are well underway, certainly for that side of the program in trying to develop those priority lists and the risk matrices. It is a state-run process, so my understanding is that at the Department of Health level, those resources to be able to roll out the program are currently under development. So I think in terms of an actual rollout at each HSP, you're looking at early next year. So I would be expecting around the February time.
Okay, that's fabulous. Can I, again, Briony, I'm acutely aware of how polite everyone is. And politeness plus complacency can equal disaster. And I suppose when we talk about technical things around fit testing, there is a potential to forget that it's the basics in infection control that have the biggest impact. Has the message changed around what we expect staff to be doing in order to be compliant?
No, and I think that's a really good thing to highlight, that PPE and certainly masks are just really the cherry on top. Like, it is not the whole program. And doing the basics well really is the fundamentals to keeping yourself well and preventing transmission. So, and the messages are exactly what it has been from the beginning about physical distancing. I think is really important. I mean, we know that dramatically reduces your chance of picking the infection up from somebody who is positive if you maintain that 1.5 plus metre distance from them. Good hand washing, absolutely, and then as we spoke about, staying home if you're unwell and getting yourself tested.
That's brilliant. I think the place where we I'm being told not to rabbit on. So actually, Beck, thanks so much. We've had actually some questions come through. Let's answer those.
So we've actually had a lot of questions through for this COVID special, and I just wanted to acknowledge that we might talk about some of these with Briony and with Chris. So please listen out, because your question may be covered in what we speak about, and we haven't missed you out. And those that we don't cover, we'll pick up at the end of the show with Aresh. But I have some questions for you, Briony. Are you ready?
Yes.
When cleaning surfaces or toys using Tuffy wipes or similar, is there a way we should do that? And how far will one wipe clean?
That is actually a very good question. I think with all of these type of questions, when it comes down to use of a product, you need to look back at the actual manufacturer's advice. My thoughts with an individual item, that it would be one wipe per item. I think it's very difficult to make generalisations about how to do that, because each toy is going to be very different. But it would just be a general process of making sure that you cover all surfaces and that you have a reasonable contact time, so that the wetting time, so that the agent within the wipe can actually do its job.
Great. The second question is, if I have to wash my hands for 20 seconds, do I also have to wipe each surface for 20 seconds? If not, what is the difference?
Comes down to a degree as to the product that you're using. So the 20 seconds really comes down because that's referring to soap. which is a very, very effective at inactivating this virus because it is an envelope virus. But a lot of the products you would use on surfaces contain disinfectants or harsher chemicals that you wouldn't use on your skin. So there's not necessarily that same time requirement. What you will find though with wiping down surfaces, while you may not have a time that you actually have to be physically wiping, the fact that the product is on that surface and wet, that's when it's doing its job.
That's all the questions I have. Back to you, Aresh.
Thanks ever so much, Briony. That's been fantastic. We will come back to you a bit later if that's okay. That's been brilliant.
Yeah.
Thank you.
My pleasure.
Now, thank you ever so much. Richard, welcome.
Thank
you. Richard, I know you've been doing a fantastic job as Director of Workforce at CAHS. It's an unusual time to be taking on the role during a pandemic. I don't imagine you're training anticipated pandemic management.
No, not quite. I'm learning lots, though, about pandemics.
So, Richard, I wondered whether a couple of stuff that we could just look at, maybe looking at leave arrangements, potentially the impact of the changes to borders and working from home, if that's all right.
Absolutely.
So, can I ask you, what do the changes to border arrangements mean for staff in terms of travel?
Look, it's great that people can travel to other states now and territories for recreational purposes. Employees of CAHS still need to obtain their approval through the normal booking processes, discuss it with their manager. But I think there's probably an extra step there is actually just being a little bit more prepared about what might happen whilst they're away. So having those conversations with their manager prior to going and also seeking and obtaining the relevant advice prior to going away. So work-related intrastate travel requires specific approval processes, and at the moment we're not really encouraging that for work-related reasons.
Have you seen many people make those requests, or has it actually been quite quiet on that front?
It's pretty quiet on that front, yeah.
And so can staff travel interstate now?
Yes.
They can travel. Okay, that's. And can I ask you, what does this mean for returning to work if the quarantine requirements for the state that they visit? Because obviously people can make the trip for work, and they can also make the trip for social reasons.
Yes, that's right. So look, if someone is required to quarantine on return from a state that is considered risk, there's potential implications for that. If they're delayed, if the potential for delay to their return to work from either recreational leave or if it's work-related, we'll actually talk about the recreational leave first, because that's probably what people are most interested in leading up to Christmas. Staff who are required to quarantine and where working from home is not possible, they can access other types of leave, such as personal leave, annual leave, or leave without pay. It is reasonable that staff would be expected to provide evidence of the requirement to self-quarantine, which is usually issued on their arrival back in WA.
So they'll get a document that will give them some guidance.
Yeah, so again, having the conversation, staying in touch with their manager during such a time would be also quite relevant as well.
Okay, that's brilliant. I mean, it's interesting, isn't it? Because Brian, you talked about the change in border control coming in at a weekend and the outbreak in South Australia almost happening in synchrony with that.
Yes.
What are the arrangements if arrangements change while they are away?
Okay, so if that was to happen to any of our staff members, then really my strongest recommendation is to get in contact with your manager. We also have set up a phone line and also an email account, so CAHS COVID Workforce Team, to try and answer some specific individualised questions. So it's CAHS COVID Workforce at health.wa.gov.au. Or the phone number is 086 456 5266 during business hours, and we'll try and answer the specific questions. But as a general rule, if something happens while you're away, whether it was intentional or not, and you're required to quarantine on your return, you can access types of leave such as personal sick leave or annual leave or leave without pay. The current requirements or advice from public sector labour relations advice applicable to all WA government employees indicates that paid COVID leave is not available to cover this type of circumstance.
Okay, Richard, I actually, it's interesting how some of the conversations come back so explicitly, and I know when we were doing a radio show earlier this year, one of the questions was, look, is there a hierarchy of people who get access, not based on need, but, you know, that some people are just luckier than others? And we were very firm at that time saying that we'd gone through this enormous process to make sure that one particular group weren't favoured in another. That is, we'd had an open, transparent and structured process to stratify those who should be eligible to work from home and those who can't. We are ultimately a hospital that at its core, or a health service at its core, which is about delivering clinical care, which involves a direct contact. But so we had come up with those arrangements. Are staff still allowed to work from home based on the original arrangement set up in March and April this year, or have we changed the rules and the regulations?
So most people have actually returned to work from those original arrangements that were set up back in March.
Yeah.
So if you're planning to have leave and you anticipate that there may be a requirement to do some work from home, to actually complete some new paperwork, because things have changed, your home environment might have changed, so it's recommended that you actually reapply using the correct process and paperwork, so that's all squared away before you go on leave.
Okay, that's. And can I ask you, where can staff find out more about working from home options?
Okay, so we have a lot of information on our intranet hub. You can either go to the COVID workforce hub, or you can just go to the workforce working from home page, which is either way will get you to the right information, and the forms are available online. That's
brilliant. Beck, I know you have had a question come through as well. So Richard, here comes a surprise.
What about if they have people visiting them from interstate, especially if there are quarantine requirements from those states? So what happens to those staff who have visitors from interstate?
So they have visitors in their home?
They have visitors in their home.
Yeah. So there's no specific leave provisions available for this type of situation. So my suggestion would be you follow the Chief Health Officer's advice in relation to that circumstance, and if you are required to quarantine, then you would need to ask for some of your available leave, so personal, annual leave, etc.
Richard, one of the bits that we have been emphasising, because I know health professionals, and that embraces everyone who works in our health service. The strong advice is, if you're unwell, don't come to work. Is there a second step that they need to take in terms of informing us that they're unwell, so that we can potentially keep track of that?
Look, at the moment, the best advice is to keep in close contact with their manager.
Yeah.
We're working on a system that we're just in the process of testing that, and we would like to roll that out within a few weeks' time. So we'll have a little bit more information around that to actually enable that to occur.
So but we have robust systems at the moment based on a reliance on individuals to self-report, that one, to stay away, and two, to just take that step of informing their managers as well. We'll obviously be tracking it here because people won't be at work, but
That's right.
we really are asking them to help support that process by calling in and telling their managers they're not going to be there. Okay, that's absolutely fantastic. Richard, thank you as always for the tremendous clarity that you bring to what is always very thorny issues of working out HR, and thank you for your support and advice outside the times in which we're running radio shows.
Oh, you're welcome. Thank you for having me.
Thanks, that's fantastic. It's fantastic. We have Professor Chris Blyth, who's Head of Infectious Diseases at PCH at CAHS, actually with us. Chris, welcome. I think you've previously been with us, but you were at the end of you might have been our very first guest at the end of a telephone, or can you remember? You were at the Department of Health at the time.
No, I've been here in person for one of our radio CAHS sessions
You've
as well.
been here as well. Oh my goodness, you are such a regular. But my memory of you was at the end of a phone, but it's great to see you physically as well. So it's I know that today you picked up your 10-year long service badge. So many congratulations for surviving us for 10 years. That's fantastic, and for your contribution. That's great. I wondered whether I could just pick up on a couple of bits around vaccines and then maybe some reflections on COVID. You have been one of the busiest individuals over 2020 that I have seen, actually, Chris, always with good cheer. We've been hearing a lot about positive news coming out around developments around vaccines. I wonder what your understanding is of where these clinical trials are and what it means for us going forward.
Sure. Well, certainly the clinical trials are being reported in the media, so people will be hearing these news. And importantly, some of the news is quite exciting. So a number of the phase 3, so the large international trials that is really trying to understand how these vaccines work, and importantly, whether they are working, are reporting quite some really interesting and actually very encouraging results, actually more encouraging than many of us initially thought. So at least 2 trials have reported some of their phase 3 data. They're showing these vaccines are effective in protecting against COVID, and that's clearly what we're trying to reach for. Now, there's a number of steps, importantly, between that and when we will get a vaccine, but it gives us increasing confidence that we will get a vaccine, and it's likely that we'll get a vaccine in 2021.
And can I ask you, does phase 3 mean there's a phase 4, or does phase 3 mean, because you said there were a number of steps, so is there a phase 4, or is there phase 3 and then it has to be manufactured for production en masse? Could you just guide us through that bit?
So there is a phase 4, but let me take you back. So phase 1 is where we use a small number of doses, usually in healthy adults, to make sure that the vaccine is safe. Phase 2 is where you then start seeing whether it elicits the right immune response. Phase 3 is where you actually usually give it to tens of thousands of people to see whether it actually protects against disease. And then phase 4 is usually after you've actually started to use the vaccine, where you evaluate how well it's working, not just in the population that you gave it in the vaccine, but a broader population, and you continue to monitor for efficacy, effectiveness and safety.
Thanks for the clarity, as always. I mean, practically speaking, that we read about it every day. I think it's one of the things that's bringing a smile to many people's faces and giving people some substance to 2021 maybe being brighter than 2020 has been. But when do you think realistically, if we maintain the momentum that appears to have been set up, are we going to see this potentially becoming available in Australia?
It's the million-dollar question, and it's a hard one to answer. I suppose it's useful to answer what are the steps required between now and effective vaccine program. Well, the most important one is we need to see these data from the phase 3 studies in its full detail, not just in a press release. When you need to register the vaccine, so the Therapeutic Goods Administration, the Australian regulator, as well as some of the international regulators like the FDA and the MEUA, need to register the vaccine, and that is a critical step. We need a registered product that we're comfortable works and is safe. And then we actually need to start rolling it out from a programmatic perspective. It's likely that's still months away at this stage, but actually some of these early results that have come out in the last 2 weeks really highlights that things are moving incredibly quickly. People are working incredibly hard in the Australian context to look through these data, but importantly start designing the program that we need to be able to move as quickly as we can. I'm going to preempt a question which lots of people ask me though, is that, well, does that mean that things are being rushed? Importantly, the barrier to a vaccine is exactly the same for any other vaccine that we have. It needs to be registered, it needs to be proven to be effective and safe. Now, many of the trials are being run concurrently and moving between phases quickly, but actually the final barrier to us having a vaccine is exactly the same for this vaccine as every other vaccine. So I can reassure people that we're not rushing this vaccine process as far as the final critical steps we need to have confidence in the program.
I suppose maybe I'm keen to have the vaccine when it comes, based on the assurances you've described, that irrespective of the challenge that the planet is facing at the moment, that there are these safety mechanisms in place before the needle's going to touch our skin. Mm-hmm. Can I ask you just one of the really stark things that professionals like you have reminded us of is that actually we faced pandemics, or at least sat on the very edge of pandemics several times over the past decade. And do you think this change has there been an enormous step forward in the science of vaccines and technology that we will find ourselves in a different place in terms of generating therapeutic agents if there was to be another pandemic in years to come? In fact, there will be, but do you think that the technology has accelerated, our knowledge of vaccines has accelerated?
Absolutely. The technology that we've got available now compared to 10 years ago when we had the influenza of 2009, the swine flu pandemic, is vastly different. Now, importantly, the amount of options available to reach to, the pace at which we can move now is vastly different. So it will shape our ability in the future to respond to emerging threats, and there will continue to be emerging threats. We are such a global moving population now that if something new emerges, it will always have the risk of spreading. So yes, we're in a vastly better place than we were 10 years ago. But importantly, we need to learn from what we did 10 years ago and 20 years ago as well, because there are things that we can do better.
And can I ask you, just, I genuinely meant it, Chris. I think you are one of the people who has been super busy during this year. And I just wondered whether, even though we're not sitting on at December the 31st, whether there was any reflections you had over this past year that you would want to share with us. Positives?
That's a hard question, actually. So it's been an incredible year. I think it has demonstrated our capacity to pivot, our capacity to change things when they needed to be changed, our capacity to come together as a community, and I think the Australian community more broadly has done a tremendous job as far as the things that we needed to do to try and prevent this pandemic spreading through. I think we only need to look internationally how lucky we are. So we have done well in that regards. As a health service and a hospital, it's quite incredible to see how quickly things moved, and our ability to pivot was also highlighted there. And so I think that's actually given me hope that actually we can rise to the challenge, and there will be challenges in the future, and we can be nimble and respond to that as we need to.
That's fantastic. Do you think the next 12 months, what do you think the health service will look like over the next 12 months and the community? Have you had even the time to cast your mind forward 12 months and maybe reflect on what it'll be like when this is an international radio show?
When this is an international radio show. I know what I'd like it to be like. Now, whether that's possible, there's unfortunately lots of things that could get in the way of that. I'd like us to have an effective vaccine that will basically provide the immunity we need to restore the lifestyle that we had. Now, I'm not sure that we can go back to a time that's completely before COVID 2019, but restore many of the privileges that we had in Western Australia at that stage. Now, there is a risk with that. Unfortunately, having an effective vaccine is one of the critical steps, and making sure that we do the right thing and prevent COVID transmitting in Western Australia is one of the challenges that we face. Now, we're all in this together. Importantly, we need to look after each other. We need to respond quickly. We need to listen to public health advice. I'm hoping that we will get to a vaccine before we get to the alternative. There's only two ways out of this. It's immunity, and there's only two ways to immunity. It's either a vaccine or it's by infection.
And can I want to just take a step back, and I then want to ask you a personal question, if that's okay. When vaccines come, is there some thoughts around how long will a vaccine last?
So we know from previous vaccines that vaccine immunity wanes. How quickly it wanes varies on the vaccine, and because we have a new pathogen here, a new virus, we don't know how long that's going to last. Importantly, we may not need a long-lasting vaccine to stop the halt of this virus, but it is one of the million-dollar questions: how long will immunity last?
That's fabulous. I mean, look, I think, been reflecting on how busy the health service is at the moment. Everyone is absolutely working at their limit, I think, at the end of what has been a very challenging year. And I suppose I just wanted to, in our conversation, reiterate the need not just for vigilance, but also the need for people to look after themselves. So you don't look after yourself just when you become unwell. Prevention is as important, and the need for recuperation is critical. So I just wanted to also take this chance to encourage people just to be honest and get on top of some of the fatigue that's set in as a result of the hard work. And I just wondered whether you had any holiday plans, Chris.
I do have a couple of weeks in January, and I'm looking forward to those. It has been a busy year for many of us. It's been a challenging year. I don't think 2021 is going to be any less challenging. That's exciting in many ways, but yeah, I am looking forward to a holiday.
That's fantastic. I know it's interesting. Many of the people I've talked to have actually, one of their positive reflections on 2020 is they have spent more time with family in WA because they've not had to leave. So I think I wonder whether that sense of family is stronger at the end of 2020 than it was at the start as well, but only time will tell that. But Chris, as always, I just want to extend our heartfelt thanks from the health service and from children and families for the enormous contribution that you've been making to the management of the system in addressing some of the problems that COVID poses and the risks that it poses. You're an absolute superstar, so thank you very much, and I really hope you enjoy the holiday, the very well-deserved holiday, and that Santa's kind to you. So I just want to bring the show to an end. It's been a COVID special. I want to thank Dr. Briony, Hazelton, Richard Prunster and Professor Chris Blyth. We've had Dan Yeo join us a little late. I think he's been celebrating the fact that he won the CAHS Innovation Prize this week. So Dan, congratulations to you. Thank you for joining us. That's fabulous. This podcast will obviously be available on Monday, but I just want to really reiterate some of the basics. We've talked about fit testing, we have talked about vaccinations, we've talked about borders opening, but the reality is, I think every expert has told us the basics are the most critical steps you can take. Please stay at home if you're unwell. Please call the staff health advice to check around what you need to do. Can I ask that you very politely and respectfully challenge those who are not compliant with the guidance that we have? I know it will lead to a moment of discomfort, but believe me, it may save some lives. So the 2 square metre rule applies to decide maximum numbers in a room. 1.5 applies to those in the space. Both aspects are important. Please follow the recommended numbers in the lift and to challenge those if the numbers increase, or maybe gently step outside to reduce the numbers there. Please wash your hands regularly and practice good hand hygiene, and make sure that your contact details are up to date in your Outlook account, as it provides another way of allowing us to do contact tracing should that dreadful need be required. And please take time to look after yourselves and encourage others to do the same. Many thanks for your immense dedication to children and families in the work that you do each and every day, for looking after each other. And please, if I don't get to talk to you on the radio, have a lovely Christmas and New Year. Look after yourselves.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr. Aresh Anwar.
Welcome to Radio CAHS.